Hi, my name's Hannah. I am going to be telling my birth stories for my first two kids to kind of give some background because I've decided to do kind of a remainder of pregnancy vlog because I am currently 24 weeks pregnant, which you cannot see because I'm sitting, but there it is. There's a baby in there. Hi. So, my birth story. So I have two kids, Rosemary, who is going to be 4 in July, and Jack, who is 17 months. So I was working as a dietitian and I just had like a pretty normal pregnancy. I probably worked about 3 days a week. My husband was in residency, so he was really busy. We were trying to buy our first house. I was busy, but I didn't have any kids, so I got a lot more sleep that pregnancy than you will ever get again in a pregnancy, which was nice. I was really athletic. I worked out a lot. I liked to do that, but then I had a relatively sedentary life outside of that because of my job. So basically everything was normal. I was really healthy. My weight gain was maybe a touch high, but I really tried not to stress about that. I did stress about it, but I tried not to because I knew that I was a healthy eater. I obviously was a dietitian, and I kind of just had to learn to trust my body a little bit. At least that is the philosophy that I came out of pregnancy with by the end of things. So that was probably the only struggle, and I think a lot of women have that. But in the end, around, I don't remember exactly, probably 30 weeks or something like that, my doctor was feeling around, and so she pulled out the ultrasound machine, and my baby was head up, which I think it's somewhere around 30 weeks when they start to kind of go, okay, well, we're gonna have to watch that. So she said, probably it's gonna resolve. You know, they always will say that because it's true. Most babies, only 3 or 4% are gonna end up breech by the time they're birthed, which is not a lot. So she said, let's just give it time and we'll monitor it. So we did, and I did the pool. I did like inversions where you're kind of like leaning forward on the couch for a couple seconds at a time, just all the things you can do. And you can look at sittingbabies.com. It's way more in depth. If you ever are in that position where you have a breech, there's a lot that you can do. There's techniques. I wasn't really used to going to a chiropractor or anything, but if I had a breech again, I would go because there's just some skills that are a little outside of normal medicine that people use, and sometimes it helps them. And you know, having a breech and having to have a C-section in a lot of parts of the world, that's what that means as far as the US at least, is a big deal. So I think I would have been a little more assertive, but I did try. and nothing happened. So we scheduled an ECV, which is an external cephalic version, at 36 weeks and 3 days. And that was to try to turn her. It's a procedure that's supposed to be about 50% successful, but a little bit less than that in first-time moms. From my memory, I'm not a doctor. It depends on you a little bit and your doctor and how skilled they are at all of that. So if this finds anybody who's got a breech, just definitely look for good quality doctors and resources and people who are supportive to come talk with you about it and figure out what you want to do. But for me, that was what I wanted to try because I really didn't want a C-section. So we tried. We went in, my husband came with me. He was on a lighter rotation for residency then, so he could do that. They gave me, it's called a tocolytic, I think, and that is a drug, which I don't remember the name of, that like basically relaxes your uterus so that it'll be easier to manipulate. But I think it also makes you a little shaky. And then I didn't take any pain medication for it. I think just because I was planning on going to work later that day, so I didn't want like an epidural or anything like that. I wanted to be able to go to work later. And so I just kind of gritted it out. It does hurt. Some people, I guess it doesn't. It's probably less likely to hurt if it works, from what I would gather, because why it hurts is it's rubbing up against a spot your body doesn't want to let it go past with the baby's head or the baby's butt. So they tried one direction and then they tried the other direction, and it was not happening. So after they tried quite a bit, they were like, okay, she's not moving today. And I think I had asked about maybe, okay, can we try again in like a week? I really don't want to just like give up. And I think they were gonna be okay with that, probably. I'm not 100% sure, but I think so. That's not uncommon, that happens. People have that story for sure. But they were checking me out, and I was gonna go home, and we were just like, all right, well, this might not work out, because nobody in my area that I was aware of, and definitely not in the hospital even now that I'm aware of, does vaginal breech birth. You just have to have a C-section, because nobody, I mean, you could demand it, I guess, but nobody's like skilled at it. They don't have the expertise. And there are some risks with breeches, very rare, but the risks are best managed by somebody who knows what they're doing. So that's, that's a personal thing. You can take those risks. Some midwives do them around here. I wasn't personally comfortable having a risk come up and then not be in the hospital, especially for my first pregnancy. And so I didn't do that. But anyway, I also hadn't looked at the data as well as I have now on that kind of thing either, because again, I wasn't quite as assertive in the first pregnancy. But it didn't really matter in the end, because what happened is they looked at her ultrasound and she had a bleed. It was like a bleed on the placenta, basically, from what I understand. And that was concerning. And they were like, okay, well, we're gonna have to either keep you here and monitor this, or just do a C-section right now. Which I was like, oh, I was gonna go to work today. Like, that's, neither of those means going to work today. That was pretty shocking. And they had a second doctor come in and look and verify that, yeah, that looks like a bleed. And then my husband, because he was in residency, because he works as a family medicine doctor now, and he was training then, I looked at him because I was like, okay, what do you think? Like, I know the doctors are giving me this choice, which is great that they did give me a choice, by the way. I think any choices doctors can give you, they should, and it's great that they do. But I just wanted his opinion, because he kind of was a little more familiar with the medical side of it, and he was just like looking at it and like, I think we'd take her out, because we knew it was a girl. So we did. So like 30 minutes later, she was born. I was rolled right down the hall, a couple doors down. Anesthesiologist came, gave me spinal, so blocks everything. You don't feel anything, they check, make sure you don't feel anything, and then out she comes really fast. Easy peasy. It was weird. That part is weird, when you're just like not expecting to have a baby, and then suddenly, here it is. Here's your baby. Like, you're like drugged and a little shaky, and like, that was very surreal. It was just, I don't know what to tell you about that. But birth is pretty surreal anyway, so. Anyways, they weighed her, they put her on my chest. They were actually really good about that kind of stuff. Like, I hear a lot of stories about people not getting family-centered cesareans. And I think for us, considering that kind of abrupt situation and no planning, they really had some pretty good policies. They really kind of made it as nice for me as they could. Their anesthesiologist was really nice and supportive, and like kind of talked me through how I'd probably feel the whole time, and they kind of warned you, and they brought her to get checked, but they put her on my chest really fast. They still did as much skin to skin as they could. We had like at least 45 minutes, I want to say, of like that golden hour right after, like, even though she was premature a little bit and they wanted to check her, she was okay for right that moment. So they let her do the breastfeeding and everything right away. So I mean, I really was really well treated, actually. I don't really have anything super negative about that experience, except that it was just a little traumatic, because it was something I didn't want, and it was really out of the blue. So that was hard. And also, I would say I don't remember the first day very well. My husband laughed a lot the second day because I didn't remember anything that they had told me, and I'm very detail-oriented usually, so me not remembering was a little bit weird. Like me not feeling very together or there for the first day of her life was just definitely probably a mix of the shock and the fact that I had received some drugs that kind of alter you a little bit, I think. For me anyway, that was my reaction to it. That is her birth story. We were so happy to have her, and I was just, I was really glad she's okay. But it was, I knew right away I didn't want to have to do a C-section again. So that's where story number 2 comes into play. If you don't know what a VBAC is, that is a vaginal birth after cesarean. It means you don't want surgery. You're like, no more surgery for me. Thank you very much. If I can avoid this, I will. That's a VBAC. Now, I mean, some people are a little bit less adamant than I was about that. Like, they're a little more on the fence because there's risks and advantages to VBACs. But for me, I looked at all those and I knew that for me, because we want a big family and the risks are worse the more C-sections you have, we wanted to have the option to have as many babies as we wanted to. So a VBAC was definitely the right choice for us. And you can have a lot of C-sections, but the risks just go up a lot. So for my body and our family, that was going to be the best choice we felt, if possible. So we planned. I found a doctor who my friend had had a VBAC with, and he was very supportive, very confident in the ability to VBAC. So I really liked him for that. And he just was like, sure, that's not going to be a problem. He's like, I mean, you can never guarantee anything, but this is going to be fine. This kind of his attitude, which was perfect for me. I needed that because I'm kind of like a more nervous person, but I was confident too. I was just like, yeah, I really think I can do this. I really think it was just the breech thing. We're going to be fine. So I prepared, I read, I watched YouTube videos just like this one, like crazy. And I read all the research, and when I say research, I mean, because I have like a science background, I mean, yes, I looked at the websites that talk about things and are sort of more story-based, but I also read hardcore scientific journals, like the research, the scientific research that is published in journals and peer-reviewed and very dry, I guess, because I wanted to know everything that I could know. And that was really helpful in the sense that I just felt like very prepared for what I wanted, what I didn't want, that kind of thing. And what sort of things were or were not reasons to be concerned in the middle of a labor. So there's sort of standards of practice sometimes, the way things hospitals just do it because that's their policy, versus do you, as a person who's looked into the data, feel that that is absolutely necessary for you? And that was the part that was really helpful to me, is because I had looked at the details of certain aspects of things and I knew what I was comfortable with based on the research and what I was not comfortable with. And it wasn't always exactly what the hospital's policy was, but I could advocate for myself and say, this is what I'm okay with, this is what I'm not okay with. And most importantly, like, decline intervention if I didn't really think it was necessary yet. And kind of have my doctor kind of back me on that. And he was really good about kind of being hands off. So anyway, fast forward, we get all the appointments, everything's fine. Praise the Lord, he's head down, no problems. I was getting closer and I think pretty confident that I could do it, but a little bit starting to be stressed. And this happens for a lot of people. I was a little bit stressed about hospital policy, because you just have to pick the best combination of provider and hospital and insurance coverage that you might have in your area. And for me, because the doctor was really great and the hospital was known to be pretty VBAC friendly, but they're not perfect as far as like letting you have freedom to make some decisions. They just had some hard policies. I was a little bit nervous because they wanted me to go into labor by 41 weeks. And their policy was do that or C-section, which to me was like, seriously? You're just gonna like put a timer on it and then we're just gonna operate on you after that? Like, that's how that comes off. And if you don't know to question it, you're just sort of like, oh, I lost the lottery, I guess I have to have a C-section. That's how it makes people feel, because that's what they're telling them. That's so silly. You get to decide. Like, this is your baby, you're the one having surgery, you're the one that doesn't have to have surgery, basically, if you don't want to. And if you're more comfortable with that, great. But I was not, and I didn't feel very good about having to fight them on it. So I was so nervous about that. So I was gonna have membrane sweeps, which is supposed to help trigger labor if you're close. And then we found out that I was GBS positive, which I guess in my doctor's office, this is not true everywhere apparently, but their policy was not to do it when you're GBS positive, because standard of practice was, at least the way I understand it, I might be misquoting this, was that it might be a risk for infection. So I did some more research. I found a study, and it made me pretty comfortable that the risk of infection was either not any higher or not enough higher to be worth not helping me to get into labor. So I ended up going ahead and asking for a membrane sweep at 1 day past due. So I was 40 weeks 1 day. Doctor was fine with it, so he did a sweep. I didn't really mind that too much. I think I was like a centimeter dilated, so it was enough that he could do it. That you have to be a little bit dilated, I think, to do it. So I guess that was like midday on a Monday, I think. And then the Tuesday night after the membrane sweep, probably around 8:30, that is when I started feeling pain. Just a little bit. To me, it did feel like menstrual cramps. Some people will describe your stomach tightening, which is how I've experienced Braxton Hicks, and even in that pregnancy I did. But that is not what it felt like for me when I was having contractions. I didn't feel the top tightening at all. I only felt menstrual crampy. And I started to realize that they were happening kind of sequentially, really kind of close considering they just started. It was like 5 or 6 minutes apart. But they weren't super strong. So I was like, okay. So I just finished my night and put my daughter to bed, and we kind of got ready for bed, and we went to bed. But I told my husband, I was like, I think there's something going on here. So I timed them and just kind of kept it up with my app, and we went to bed. They were coming 5 minutes apart, which made it very difficult to sleep, because even if it's not really strong, that's very distracting, and it does hurt, and it does wake you up. And at least in my case, this is what was happening. So it made it really hard to sleep. I tried for like an hour and a half, and I got up for a while, and I just like watched Netflix and sat in like that butterfly position where your legs are open on the couch and just let them come, because they hurt but not bad enough to really stress me out. And then probably, I don't know, a few hours later, I gave up on trying to be awake. I was like, I really need to rest. This is just very prolonged. It's not super strong, but it was still really hard to sleep because they were so close together. And that's also just, I mean, if anybody's told you to rest while you're pregnant, you're trying to like have a baby, and it's especially if it's your first labor, which for me it was, that is really hard to do just because you're distracted and you're anxious. But also for me, it was because they were not very spread out at all. So I probably got another hour, 2 maybe, of like laying down. It would be really a stretch to call any of this sleep. I wasn't sleeping, but I was resting. So I did that. And then eventually at like 4:30 or something, I think, maybe a little later, it was probably pretty early, I got my husband up, and I was just like, I need company. I'm an emotional person when it comes to that. I was like, I need support. This is stressful. I need you to hang out with me. I'm bored, but I can't sleep. And so he was like, I'm probably gonna go to work today. Let me sleep, please. I need to be able to work well. And I was just like, you're not going to work today. I've been having contractions all night. What are you talking about? Like, well, no way. You need to call in. So he was sort of still not convinced, which in his defense, he's seen a lot of labors. He knew it was going slowly. He could just tell. And he wasn't wrong. But I still wanted him there. I ended up convincing him to call in. And I was just like, if you have to take an extra day more than they were thinking of, they're going to understand your wife's having a baby. So please just do it, because they really need you. So I did. And he did. And then we spent the day, my mother-in-law came and took my daughter kind of that morning at some point. We spent the day just like watching TV and working through contractions and just keeping in touch with my doulas. By the way, that is an important part, which I didn't mention. Having a doula is literally statistically likely to help you have your VBAC. So if you are going to have a VBAC, if there's any way you can get a doula, it's really, really good. It was very important for me. So we were laboring. It was pretty much 5 minutes to 4 minutes apart the whole time. They were getting to a minute long most of the time. My husband, being that he knew how to check cervixes. We actually had just gotten some sterile gloves, and he just did it. He would check me every once in a while, and it was very slow. I was dilating like 0.5 centimeter every couple of hours, maybe. But it was happening, obviously, we could tell. So it was so slow. Probably by 7 p.m., so it's been almost 24 hours by that point, we decided, okay, we just finished up a nap not that long ago. We actually got an hour nap. My contractions were like 1 hour spaced out to 7 minutes, and I got a nap, and it was great. But I was like, let's go in. Let's let them know we're coming. And I checked into triage. They did all the checks. They were, I think, pretty okay with keeping a VBAC relatively soon, even though normally they may send someone home who's only like 2.5 centimeters dilated, which is what I was when I got there. And then they assessed me at like a 3 later on, like an hour later or something, not that long. So they admitted me, but I think it was because it was a VBAC, so they wanted to be a little more careful. Anyway, they wanted me to maybe think about getting an epidural, because they say, like, if you do end up needing a C-section, it's much easier to sedate, or not sedate you, rather, to like make it so you're numbed through that same connection, rather than having to just push you out if you have an emergency. But I kind of told them, I really want to be able to move around as much as possible, so I don't want to do that unless I really just can't take it anymore. And if that means that suddenly we have a crash C-section and I have to be passed out, that's fine. That's a risk I'm willing to take. It's not gonna really make a difference in terms of the outcome for the baby. That just means my experience might be a little bit different. But at that point, all I want is a baby and me being okay. Like, if it's really that bad. That's what I told them. So some people feel differently about that. That is just a personal preference thing, really. So we did that. We waited. I labored all night long. My doula came with us, and then my husband was right about this too. He was like, we've only got her for 12 hours. This does not seem like it's going to be done in 12 hours. And maybe we should let her go home for the night. And I was like, okay, because I knew that was true. And I hadn't conceived of just paying extra to have them stay longer, which I will do for this one. Totally wish I hadn't sent her home. Doulas are really great at. They kind of are trained to do physical support, where they're just making you comfortable and they're helping you emotionally to like process everything. And that can be really wonderful. So I didn't have that overnight. I wish I had, because I was in a lot of pain, and policy at my hospital was you had to be monitored once you were admitted for your heart rate on your baby, and it just wouldn't stay. So when I was laboring the way I needed to labor, comfortably, moving around, it just kept coming off, which was so frustrating, because it made it so that I was getting bugged about keeping my monitor focused instead of just letting me labor, and I hated that. And I really wished I would have had somebody who was like kind of a second voice, kind of helping to, okay, well, what can we do to help this be comfortable without this problem? Like, it would have just been really good to have somebody kind of there helping to get me comfortable while keeping that monitor where it needed to be. And the nurses are just too busy for that a lot of times. So I was kind of just told, oh, the heart rate's best this way, super painful position. That's where I stayed for a long time. I don't recommend it. I recommend having somebody help you stick up for yourself when you're exhausted and find a position that works. So all night long, pretty darn uncomfortable. And then we got till the morning. I don't remember what time it was, somewhere between 7 and 9, literally don't know. My doctor got there, I was 5 centimeters, they broke my water, things started getting hot and heavy really fast, which happens when they break your water most of the time. That cushions the contractions. It was accelerating until it was maybe 2 apart after a couple of hours probably. Don't really know exactly. I lost complete track of time because I went into the zone, which happens a lot to people when they're having their babies. And I was just surviving those contractions, just one after another. They were getting closer and closer. They were starting to be on top of each other. Doula was there finally. Yeah, we called her in the morning, and she was just giving me juice, and I was just like, I don't even know my husband was there. I was holding his hand sometimes. I don't even remember. I don't remember, because you get into this zone and all you're thinking about is trying to listen to the voices helping you breathe and learning what the breathing is supposed to even feel like. They try to show you, but it's really hard. I kind of caught my wind on how to breathe best for me, like probably 2/3 of the way through this little hot session of intensity, which now I'll know for next time, hopefully. But, you know, it took some learning. Even though you're trying to practice it ahead of time, it's just, you aren't experiencing the pain. You don't know exactly what to do. So we worked through that hours and hours. I was checked at some point, like a couple hours after the water broke, I think, and I was 6 centimeters, so it's a little farther. But I was still just going through a lot of this heavy labor. And then I think it was probably, I don't know exactly, maybe like 2 p.m. It had been like 4 or 5 hours, something like that, since they had checked me like before. And it's kind of a long time, but I was really exhausted and starting to shake, which was probably transition. That happens, but we weren't really sure. And it's been so long physically for me. I'd already been awake for almost, you know, basically I didn't get to go to sleep the night before, so I'd been awake for like 3 days or something by that point. So I was exhausted, and we just weren't sure whether I was shaking from exhaustion or if I was about to transition. I think I was about to transition in retrospect. But anyway, I wanted to know how far along I was, because if I was close, I did feel like, you know, this might be why, then I was just going to go for it. I was just going to let this maybe happen. But if I wasn't, I thought, gosh, I think I might need an epidural, because I don't know if I can even function anymore. I can't even stand up. Like, this is painful and I'm exhausted. That was more what it was. Pain, I could manage. It was hard, but it was the exhaustion, which a lot of people will tell you. So I will say though, I think the exhaustion was made worse by having that limited motion overnight, not being able to move around. I really think that would have made a big difference, because that is exhausting, to have to be sitting in positions that hurt more than they need to. That is what wore me down the most, honestly. I can safely say. So, you know, consider that if you can in your birth plan. If you want to not have an epidural, I think having that freedom to move is really important. And I will probably be a little more stubborn about it this next time around. But I would still be open to an epidural, because it can be really helpful for some people. You just can't control your birth. Mine did fine with an epidural. We got it. My contractions already seemed to chill out after that, which is part of why I think I was in transition. But I got the epidural. And then, you know, it worked. Didn't feel anything. Contractions kept happening. They measured, because they were starting to wonder, because my progress was kind of slow, if I needed some Pitocin, because they weren't sure. I was just progressing a little slow for what they were comfortable with. I would argue part of that is just that hospitals really like it to be on time. And some people labor slowly. But I was fine with thinking about moving it along a little bit if they thought that that might be helpful. So they measured the strength of the contractions, and they did find them to be a little bit weak, which I was like, really? Because these are really intense. And but for some reason, that's how it was. Didn't know why yet. I have a theory now. I'll tell you later. But basically, they were like, okay, yeah, let's do this. So they had the epidural in. They did the Pitocin. It started the tiniest little bit they can, because Pitocin is a little bit risky for VBACs, because it's a little bit harder on the scar, which the main risk that you think of with VBACs as opposed to other births, which have all those other risks besides, you know, any other risk, is kind of normal. VBAC risk is about that scar breaking open. So they worry about that. That's why they did a really, really small dose with the Pitocin. But they did it, and it did, I guess, strengthen them enough for their measurement. And so they did the little head monitor. If you've ever seen one of those, they stick it on the baby's head inside to measure. And so that was how they knew that they were strong enough or not strong enough. And so we did that, and then we just waited. And when you get an epidural, you have to get a catheter in. So the whole time I was telling them, I have had catheters in before. I know what they feel like. They feel like nothing. this does not feel like nothing. It feels like I have the constant urge to pee, and it feels like I'm peeing my pants all the time. Why do I feel this? And I asked them, and they were just like, you shouldn't be able to feel anything, but also like that isn't a big deal. Like, let yourself pee. And I was just like, you don't understand. Like, every time I have a contraction, my instinctual urge to hold my urine in is being triggered. You know how when you like have to pee really bad, but you're not at the toilet, you basically instinctively tighten up? That was happening. And it was something I was trying so hard to override and relax because I didn't want it to impede my baby moving down. And that was in my head what I was thinking. I was just like, I don't want to tense up and, you know, hold this baby inside. I knew he was a boy, so I was thinking I don't want to hold him inside because I'm so tense, because I keep tensing up when I feel this urge to pee. And it's like, I'm not trying to, it's just instinctive. And so I kept telling them that. I was like, I don't care about peeing. It's just that I can't help it. It's like making me tense. And so they really just thought I was being nervous about it. Finally, they looked to see how far along I was, because I was insisting something felt weird. And I was like, can you just look at it and see what's going on? And they were like, oh, you're pretty much complete. There's just a lip here. So that means I was pretty much fully dilated. And they just needed a little bit more to come away, and I was gonna be good to push. So then we started to think, oh, baby's head is pushing on your bladder. That is why every contraction you feel this, it's pushing on your bladder. His head is coming down past there. So that made way more sense. My first little practice push that they had me do right after that was kind of a little bit nerve-wracking because his heart rate decelerated a lot, which is never a good sign. And I think somewhere towards the end of this, when we were doing the epidurals and everything, they had already talked about, well, his head might be too big for your pelvis. You know, we'll have to see, and if so, you know, that's gonna need a C-section. Which this is one thing I had definitely heard about before. I had researched this thing about cephalopelvic disproportion, and it's something that's suspected really often, but it's really, really rare. So I was just like, doubt it, guys. Moving on. But they were still thinking about that while this is going on. So he had a deceleration in his heart rate from that contraction. So they turned me over my side, my left side, you know, for the blood flow. That's kind of a standard thing if you haven't heard of it. Going on your left side to get as much blood flow to the baby as possible, just to make sure their heart rate stays high enough. They do that. I'm kind of laboring on that side. We just stay there for a while and wait for the doctor to come because I'm going to be ready to push soon. And they're just monitoring, and everything looks good. His heart rate bumps back up, no problems, and we're just going to make sure that doesn't keep happening, is essentially. Because that's more of a, you know, if the heart rate keeps dipping, there's concern like something's not right. And that would be a reason to have a C-section. So that's what they're looking for, but it didn't happen again. What happened is I got the urge to push while I was on my side waiting for the doctor. And that, when they say that just takes over, that just takes over. I couldn't stop it. It just pushed. And I was just there. And so I think the nurses were a little bit like, oh, she's gonna push this baby out. So they had me turn over, and since I had the epidural, I did end up delivering on my back, which was fine because at that point I was so exhausted. I don't know if I could have done anything else anyway. But we started pushing. It was fine. I personally think my body was saying, okay, we're ready when we got that urge to push. Maybe he wasn't lined up right before and it was stressing him more to be pushed so early because, you know, they talk about laboring down versus not. I'm probably going to labor down, which means wait until you feel the urge to push, if at all possible, with this next one, because I think that that may be why. And that is not super scientific. I looked, there's not really enough data one way or another. It can be fine to go ahead and push right away. Sometimes, supposedly, talk to your doctor, make your own decision. But for me, I'm going to wait because I felt like that was really helpful to tell my body when we're ready. And he was fine. Every push after that, there was no problem with his heart rate. We pushed for, I think they said 15 minutes, 20 max was how much it was. Just several rounds of contractions of pushing, and he was moving down. And they could just see it happening really, really well. So he just kind of came out, you know. I just pushed as hard as I could, and he came out, which isn't what everyone experiences. Some people have a really long pushing stage, but thank goodness that wasn't me, because I had a really long labor. So that is how he came into the world, and he came out face up, which is probably why, from what I've heard from stories, because there isn't a lot of scientific paper type data on this, but from stories you hear, the dilating goes a little bit more difficult when their head is not lined up quite right. So it was probably why I was so slow to dilate. It was probably why I was feeling mostly pain in my cervix, because it was so much head right there. And, you know, that's just what I think. I think that's probably what it was, is that his head was malpositioned a little bit. It made it harder for him to get through, and it took longer. I think that was why it was so exhausting, probably. But he came out, he was fine, face up. I had like I think they said pretty close to a 3rd-degree tear, and he came out. He was 8 pounds, 13 ounces. And I guess I forgot to mention my little one who was born early was 5 pounds and 9 ounces. So these babies were very different. But he came out, they put him on my chest, and then he nursed really well. And we had him, and it was so exciting, because anybody who's ever really wanted a VBAC will tell you, having that workout is the most, I mean, having a baby anyway, is the most rush in the world. Like, you're like, wow, this is so amazing. I just did that. This baby is here. This is so exciting. But on top of that, for me, it was like such a relief, so happy that I did not have to have a C-section. So I felt great. And that was awesome. I was exhausted, but I felt great. So praise God that happened. I was so thankful. And that was my VBAC baby.